Penetrating keratoplasty used to be the gold standard transplantation for keratoconus. Despite the good outcomes, the risks associated with an open sky procedure, and the improvement in DALK outcomes led DALK to become the actual gold standard cornea transplantation in keratoconus. But, how about the outcomes of DALK versus penetrating keratoplasty? It depends on the residual stroma after DALK. The thinner, the better the final visual acuity. The most widely used DALK technique is the big bubble. It is the technique that can provide the thinnest residual stroma bed. We described a technique to improve the chances of getting a big bubble. This technique shares some steps of ring segments as we make a 90% incision depth outside the trephination. And make a pocket with a blunt instrument to get into the deep stroma. There are some cases in which the big bubble technique should not be used, due to the high risk of intraoperative perforation. Peripheral 90% depth incision. Then, proceed with the blunt spreader. To make a deep pocket into the stroma. Debulking superficial stroma with a crescent blade. Using a blunt spatula into the pocket. A radial incision is done over the spatula. To avoid the contact of the blade with the deep stroma. Using a blunt spatula, proceed to 360 degrees deep dissection. Very clear interface 2 weeks after manual DALK. Case 2. Advanced keratoconus. Debulking superficial stroma with a crescent blade. Peripheral deep incision. Oops, perforation. Usually there is no need to suture. As this is relatively large, it was better to suture it. The perforation does not preclude a new incision, as it is outside the trephination. Then, proceed with the blunt spreader, to make a deep pocket into the stroma. A very safe, deep dissection is achieved. Case 3, Advanced keratoconus, after ring segments implantation. The ring is deeply implanted. And there was a perforation when the ring was removed. Take your time, do not panic, air bubble in the anterior chamber. Careful dissection of the second ring. Using the plane of the dissected ring, we achieve a deep stromal plane. (55 micro-residual stroma). Manual DALK should be mastered by every cornea surgeon. In case of perforation, don't panic, don't convert to penetrating keratoplasty.